Hi everybody. Now today, next episode of the Anatomy Lab series, we're going to look at, again, continue with the skull, and today we're going to discuss the interior aspect of the skull, the base of the skull, and we're going to look at the holes and the foramina and the protrusions, and we're going to look at a lot of things today. Okay, let's get started now. Okay, now let's look at the interior of the cranium, the interior view of the cranium, and I'm taking out the vault or the calvaria or the cap of the cranium. Okay, so this is the cap of calvaria. What we see here is basically, okay, let me just put this over here so we can focus on it. And what we see here is basically these markings, these lines that we see on either side, and these are basically the markings of the vascular markings, and this is basically where the middle meningeal artery is located. So this is the middle meningeal artery is located in these sulci. At the back we have here, this is the sulcus, and basically this is the sagittal sulcus, and inside the sagittal sulcus we have the superior sagittal sinus. Basically the sinus is part of the vein, and this vein is located in between the dura mater in the skull, and these venous system are called the sinuses. And this is sinuses basically, like I said in here, it's just been located beneath the bone, the cranium, and it's located in between the dural layers. So this here is a marking of a sulcus, and this sulcus, inside the sulcus we have the superior sagittal sinus. What else do we have here? We have the oval areas where you have the arachnoid granulation, but that's not really important now. And basically, and these little holes that we see here where you have the emissary veins pass through. Emissary veins basically are the veins that connects the extracranial and intracranial venous system. So basically these connects the veins of the scalp from outside, and connects with the superior sagittal sinus veins, or superior sagittal sinus. Okay, so these are the foramens where the emissary veins pass through. Okay, so this is the vault, the calvaria. Let's look at the internal view now. Let's look at the internal view of the base of the skull. So what we see here is important structure. So the first thing that we need to know, we divide this base, or the internal area, or the base of the skull. We divide it into three important areas. We have the anterocranial fossa, which is this area here, the middle cranial fossa, and then we have the posterior cranial fossa. All right. So anterocranial fossa is this area, is primarily composed of the frontal bone, the squamous part of the frontal bone, and then we have the orbital plate of the frontal bone. And at the back of this anterocranial fossa, it's bounded by this area here, and this is basically the sphenoid bone, and this is basically the lesser wing of sphenoid. So we're going to look at this. We don't have an independent sphenoid bone right now, but basically sphenoid bone, all right, is a butterfly. Don't forget, is a butterfly-shaped or bat-shaped bone. So we have two wings there with the lesser wing, and then we have the greater wing. So this is the lesser wing of sphenoid, and here is the greater ring of sphenoid. So the lesser ring of sphenoid is part of the anterocranial fossa. However, the greater ring of sphenoid is part of the middle cranial fossa. All right, don't forget that. And so therefore, so we have on either side we have the orbital plate of the frontal bone, and at the front we have the forehead. We have the squamous part of the frontal bone here. All right. So at the back part, so we have the borders of the posterior border is composed of the lesser ring of sphenoid. So this whole area is the anterocranial fossa, which is occupied by the frontal lobe of the brain. Okay. And then we have these markings, the bony markings, the indentations, the protrusions or depressions these areas is formed by the sulci and the gyri of the frontal lobe of the brain. So brain, we will look at it later on. So we have these convolution areas of the brain. Okay, these convolutions basically fit in these depression areas. All right. So what else do we have here? At the median aspect of the anterior cranial fossa, we have this bone here, and this bone here is called the ethmoid bone. Okay, so this is the ethmoid bone. And ethmoid bone, we have at the center, we have this bony protrusion, or tooth-like bony protrusion, or it is also called the crest of a rooster. It resembles the crest of the rooster, or this bony protrusion is called crista galli. Okay, this crista galli is part of the ethmoid. All right, and crista galli is part of the ethmoid bone, and the other part of the ethmoid bone here is the cribriform plate of ethmoid on either side. Okay, if we can zoom this area here, so we have there's foramina in the cribriform. Cribriform means holes. All right, so we have multiple holes, foramina. In this area, and like 15 to 20 olfactory nerves passes through these foramina. This olfactory nerve is related to smell. So we have smell nerves on the nasal cavity. Where do we have those? So we have the in the superior part of the nasal cavity, we have these olfactory nerves, and these olfactory nerves is involved in smelling processes, and these nerves go through the upper part of the nasal cavity and then come out from these cribriform areas or foraminas through these cribriform plate of ethmoid, through these foraminas, and then they synapse with a bulb, what we call as olfactory bulb, and this olfactory bulb and then continues towards it to the brain. So this is the cribriform plate of ethmoid, crista galli. In front of the crista galli we have this frontal crest. And this frontal crest is primarily involved in the attachment, or provides attachment point for the falx cerebri. Falx cerebri is a dura mater component that separates the lateral hemisphere of the brain. So we have the right hemisphere and the left hemisphere sitting in this bone in the cranium. And in between these right and left hemisphere, we have a dura mater separating these two hemispheres, and they attach to this frontal crest of the frontal bone. Okay, it forms attachment point. Okay, so that is on either side we have the cribriform plate. I said that. What else do we have? Okay, then we have the foramen caecum, which is this. Foramen caecum is it is a blind foramen. Okay, this is the foramen caecum. And then we have the anterior posterior ethmoidal canals over here. Okay, so we have the anterior and posterior ethmoidal canals. So this is the anterior ethmoidal canal, and this is the posterior ethmoidal canal. Basically, these are openings, and they open to the orbit. Okay, they open to the orbit, and they transmit anterior posterior ethmoidal vessels. No big deal. Okay, what else do we have here? So that's the and then we have the okay. So the posterior aspect. Let's look at over here now. The posterior aspect is formed by the lesser wing of sphenoid. So this is the lesser wing of sphenoid. All right. And what else do we have here? We have in the lesser wing of sphenoid we have two important bony protrusions. We call them anteroclinial process. This is the anteroclinial process on the side. On the right side and the left side, anteroclinial processes, all right, and just next to on the medial side of the anteroclinial process we have the canal here, and this is called the optic canal here, all right. And optic canal, as you can see, it passes through. So this is the optic canal inside the orbit, and what passes through this optic canal is the optic nerve and ophthalmic artery. So through here, optic canal. So you have the optic nerve, the first cranial nerve, and ophthalmic artery passes through this optic canal, and and then basically this is the lesser wing of sphenoid, all right? What else do we have here? This is the body of sphenoid. So this is the anterior cranial fossa. So let's go to the middle cranial fossa now, all right? And in the middle cranial fossa, like I said, so we have the posterior border of the anterior clinoid processes, and then we have this. We have one of the important areas of the middle cranial fossa is this area here would be the body of the sphenoid. So body of the sphenoid is really important. So this body of the sphenoid is important. So this is the body of the sphenoid. This is the lesser wing of the sphenoid, and on either side is the greater wing of sphenoid. So this is the wings of the bat on either side. This is the greater wing and the lesser wing of the sphenoid, or the butterfly. So this is the anterior cleaning process, and by the way, this is the posterior cleaning process. And sometimes there's also the anterior posterior, and then we have the middle cleaning processes, but we don't really mention about that. So we have the anterior clinoid and the posterior cleaning process. Anterior and posterior cleaning process may be and provide attachment to the tentorium cerebelli. Tentorium cerebelli is, and again, is a structure of dura mater that separates from the brain hemisphere and the cerebellum. So cerebellum basically sits on this area here in the posterior cranial fossa, and above that you have the brain hemispheres. Above that, in between there's dura mater that separates from the cerebellum and the brain, and we call that tentorium cerebelli. And basically, tentorium cerebelli attaches to these anterior and posterior cleaning processes. All right, so this is the body of the sphenoid, anterior cleaning process, posterior cleaning process, all right? Anterior cleaning process, posterior cleaning process, and this is the middle cleaning processes. And here we have a sulcus. We call this sulcus as sulcus chiasmaticus, or chiasmatic sulcus. It's a misnomer, okay? And the optic chiasm does not sit here. Rather, the anterior communicating artery is located in this particular area. The optic chiasm is located slightly above them, but still, this sulcus is called the chiasmatic sulcus. Anyhow, that's not really important, but the important thing here is the hypophyseal fossa. Okay, so this area here is really important. This hypophyseal fossa, where you have the pituitary gland sits in here. Pituitary gland sits in here, and above that, behind that, we have the dorsum cellula. Okay, so behind that we have the dorsum cellula. Okay, and in front of that we have the tuberculum cellula. So basically, this is a saddle-shaped structure, and this saddle resembles as the Turkish saddle. They call it Turkish saddle, and this Turkish saddle is called the sella turcica. Okay, so this is the Turkish saddle. It is referred to as sella turcica, composed of the dorsum cella, fossa hypophysia, and tuberculum cella at the front here. So this whole thing resembles a saddle. Saddle is referred to as Turkish saddle. All right, and basically this is located in the body of the sphenoid. In the body of the sphenoid, if you look at inside, you have these sphenoid air sinus. So it's filled with air sinuses, the body of the sphenoid. At the back, the body of the sphenoid articulates with the basilar portion of the occipital bone. So this is part of the occipital bone, and this is part of the body of the sphenoid, and these two articulate here, all right? And this whole thing here is called the clivus, all right? So basically, clivus is formed by partially by the body of the sphenoid and also the basilar part of the occipital bone. So this is the basilar part of the occipital bone, and this is the body of the sphenoid, and these two articulate with each other over here, okay? Okay, so this in the middle cranial fossa, this is the middle cranial fossa, this is where the temporal lobe of the brain is located, all right? And anteriorly it's bordered by the posterior border of the lesser ring of sphenoid. At the back we have the superior border of the petrous part of the temporal bone. So here this is the part of the temporal bone, and we call this as petrous portion or petrous part of the temporal bone. Okay, so this is part of the occipital bone. This is part of the sphenoid, and this is part of the petrous part of the temporal bone. This is the greater wing of sphenoid, lesser wing of sphenoid, frontal bone, or the orbital plate of the frontal bone. Frontal bone, sphenoid bone, we have the temporal bone, and then we have the occipital bone at the back here. Okay, so in the middle cranial fossa, what else do we see here? In the middle cranial fossa, we see, okay, one other thing here, just beneath the lesser wing of the sphenoid, which is this, we have this fissure here, and this fissure is called the superior orbital fissure. So superior orbital fissure, as you can see, this goes to the orbit. It's over here, you see? It goes to the orbit. So it's just beneath the optic canal. I don't know if you can see it, but so this here is a superior orbital fissure. All right. So this here, just beneath the lesser wing. So this here is basically the superior orbital fissure. So this was the optic canal here, and just beneath that we have the superior orbital fissure. And basically, the superior orbital fissure passes a lot of things. Passes like the first cranial nerve, the ophthalmic nerve, and then we have the third cranial nerve, fourth cranial nerve, and sixth cranial nerve, and then we have the ophthalmic superior and inferior ophthalmic vein passes through the superior orbital fissure and goes to the orbit, and then they innervate the eye muscles and so forth. So that's the superior orbital fissure, right? So let's get to the middle cranial fossa. So in the middle cranial fossa, we see three foramens, three openings. From anterior to the posterior, we have the foramen rotundum, and then we have the foramen ovale, and then we have the foramen spinosum. Okay, let's do it again. So we can just remember that as ROS, R-O-S, R-O-S. So we have the foramen rotundum. Foramen rotundum means this foramen is rounded. It's quite a round shaped foramen rotundum. Foramen ovale, it's an oval shaped, and foramen spinosum, the reason why they call it spinosum is that just behind that there's a spinous process, and that's why they call it foramen spinosum. Okay, so what passes through these? Foramen rotundum. So these foramens are located where? Are located in the greater wing of sphenoid. So this is the greater wing of sphenoid. Foramen rotundum, the V2. V2, what does V2 mean? V2 means the second branch of the trigeminal nerve, which is the maxillary nerve, passes through. All right. Foramen ovale, okay, a lot of things passes through the foramen ovale male. Just remember that is a male. M-A-L-E. M stands for the mandibular branch, which is the V3, the mandibular branch of trigeminal nerve. A stands for accessory meningeal artery. L stands for lesser petrosal nerve, and E stands for emissary vein. So four structures passes through these through the foramen ovale male, M-A-L-E. And then we have the foramen spinosum, three M's passes. M stands for the meningeal, all right? So we have the middle meningeal artery, middle meningeal vein, and then we have the meningeal nerve. And this meningeal nerve, the recurrent branch of the mandibular nerve, it is called the meningeal nerve, and it's also referred to as nervus spinosus. So three M's, middle meningeal artery, middle meningeal vein, and meningeal nerve. All right, and basically this is called the foramen is called the foramen spinosum. And as you can see, this foramen is the middle meningeal. It comes out and forms the middle meningeal and forms these sulci, or the vascular structures in the skull, coming out from the foramen spinosum. Okay, so ROS, R-O-S, don't forget, foramen rotundum, foramen ovale, and foramen spinosum, and these three foramens are located in the lesser wing of the sphenoid, in the middle cranial fossa. Basically, they come out, these cranial nerves and vessels, and then go out beneath the skull, all right, and they go out. Okay, what else do we have here? And then we have, okay, This guy here, this is the petrous portion of temporal bone. Petrous means rock, a hard rock. So this is the petrous portion of temporal. Petrous portion, don't forget, petrous portion of temporal bone is primarily related with the inner ear and middle ear. Okay, so we have the inner ear, which is primarily composed of the balance and hearing apparatus, the cochlea and semicircular ducts, and then we have the middle ear, where they have the middle ear bony components. Okay, so we have the inner ear and middle ear, and basically, these parts. So we have the tegment. This bony part is called the tegment tympani, the roof. So it forms the roof of the middle ear primarily. This part here is called tegment tympani. It's from the roof. It forms the roof of the middle ear. Okay. So what else do we have here? We talked about that. Okay, and then we have. So this is the petrous portion of temporal bone, and again this is the middle cranial fossa. What else do we have here? We also have two important foramens here. We have foramen lacerum. Okay, so where is foramen lacerum? It's over here. I don't know if you can see it, but foramen lacerum is it's between the anterior portion of the petrous portion, and then we have the greater wing of sphenoid, and then we have the body of the sphenoid. So we have the greater wing of sphenoid, body of the sphenoid, and we have the petrous portion of the temporal bone. So in between these bony components would be foramen lacerum. So this hole here. Okay, so this is the foramen lacerum. So foramen lacerum is basically a foramen, a cartilage. It's covered by a cartilaginous structure, and basically in foramen lacerum, no important components pass through, but just like emissary veins, or the meningeal branch, or the meningeal branch artery passes through the lacerum. Just that, emissary veins and meningeal branch artery passes through. Okay, that's foramen lacerum, and just behind that we have the carotid canal. So this is the carotid canal, and the internal carotid artery passes through the carotid canal. All right. So what else? So let's go to the posterior cranial fossa here. So this is the posterior cranial fossa. So what else do we have here? So the in the posterior cranial fossa, one of the important things that we see here, on the anterior side we have the clevius. Okay, so the clevius is what? The body of the sphenoid and the basilar part of the occipital bone. And the petrous part of the temporal bone, we see another foramen here. We have the internal auditory meatus. Remember, we talked about the external auditory meatus. This is where the outer ear is located, okay? And then we have the internal auditory, or internal acoustic meatus. Just remember that these are not in one line. So if you stick a needle or a pencil through, you don't come up with the external part. So it's not on a straight line, all right? So you have so through the internal auditory meatus, you have the inner ear, middle ear, and then we have the external ear, all right? So through the internal auditory meatus, we have the second 8th cranial nerve, and we have the labyrinthine artery passing through this foramen. 7th cranial nerve, 8th cranial nerve, which is the facial vestibulocochlear, and labyrinthine artery passes through this internal auditory meatus, or internal acoustic meatus, or canal. Behind the petrous portion of temporal bone, and in between the part of the occipital bone. So this is a part of the occipital bone. This is the petrous portion of temporal bone. In between that, we have the jugular foramen. Here we see the jugular foramen. All right. And jugular foramen, and a lot of structure passes, like the 9th, 10th, 11th cranial nerve passes through, internal jugular vein, and the inferior petrosal sinus passes through these areas. This is the jugular foramen. So this is the jugular foramen. What else do we have here? And then we have the hypoglossal canal. By the way, this big canal here is foramen magnum. So this foramen magnum is located where? In the occipital bone. This is the basilar part of the occipital bone. This is the squamous part of the occipital bone. And in between you have this big foramen, which is called the foramen magnum. Just next to the foramen magnum, we have the hypoglossal canal here on either side. And this hypoglossal canal contains what passes or transmits the hypoglossal nerve. And the hypoglossal nerve basically goes to the tongue and innervates the tongue muscles. This is the hypoglossal canal. Foramen magnum, by the way. So what passes through the foramen magnum? So you have the brainstem. The last part of the brainstem is the medulla oblongata. And medulla basically oblongata continues with the spinal cord. So you have the spinal cord, the medulla passes through this foramen magnum. What else? We have also certain ligaments on the anterior compartment. We have certain ligaments pass through. On the posterior compartment, we have the neurovascular part pass through, which is the medulla oblongata. What else? We have the vertebral artery, anterior posterior spinal arteries, the meninges, and the root of the spinal accessory nerve. The spinal root of the accessory nerve passes through this area here. So this is the foramen magnum. So what else do we have here on the back, on the posterior cranial fossa? Again, we have this internal occipital protuberance. This is the internal occipital protuberance, and then we have the internal occipital crest, and this is the where the falx cerebra attaches. And on either side we have the sulci, we have the transverse sulcus. Inside the transverse sulcus we have the transverse sinus goes through. Again, on the superior goes the part of the superior part with the this is where the superior sagittal sinus goes through, the superior sagittal sulcus, the transverse sulcus, superior sagittal sulcus, and then we have the internal occipital protuberance, and then we have the internal occipital crest here. And this is where the cerebellum hemisphere sits on the posterior occipital fossa. Okay, so this is the internal aspect of the base of the skull. All right. So we went through a lot of things. So the next. Okay, so this is about it, and in our next video, let's look at the base of the skull. All right.